for coming today. As anticipated, the North Bay Parry Sound District Health Unit has their first resident confirmed positive for COVID-19. The individual is a woman in her 60s who traveled internationally. This individual should be highly commended for the actions she took to protect others. She's also a great example that demonstrates the system is working. As a traveler, she was aware of COVID-19 and followed the instructions when returning to Canada. She immediately isolated herself for 14 days and monitored for symptoms. When symptoms started, the individual followed proper protocol by calling the health unit, who referred them to the North Bay Regional Health Center's Assessment Center. The health unit notified the assessment center prior to arrival in a private vehicle, whereupon she was met by staff in full personal protective equipment, was provided a mask and isolated. After assessment, she was tested and provided further education and instructions. The individual was well enough to return home and continues to self-isolate for the remainder of the 14 days. The health unit continues to monitor her progress. The North Bay Regional Health Center's management and staff, local primary health care providers, Ontario Health, and the City of North Bay are to be praised for their exceptional work and efforts to establish an assessment and testing center so quickly. Additionally, 3 other centers have been approved within the health unit district. West Nipissing and Mattawa will be operational shortly, and Parry Sound currently is. This collaborative effort throughout the district will help to slow the spread of COVID-19 and save lives. It was expected we would eventually have a resident confirmed positive for COVID-19 within our district, and we anticipate more people will become ill with COVID-19. How many and how quickly this will occur is unknown. Sadly, we will see more cases and more people becoming ill with COVID-19. It is very likely we will have deaths as well. It will get worse before it gets better. More importantly, it will get better. Together, we all play an important role in helping to reduce the spread of COVID-19 and protect those at high risk of becoming severely ill, older people and those with underlying health conditions. Physical distancing will help to slow the spread of COVID-19 and save lives. Protect yourself and those around you by regularly washing your hands or using alcohol-based sanitizers, not touching your face, covering your cough or sneeze, and most importantly, staying home when you're ill. I was born, raised, and returned to the North because I love our communities and the people in them, because I know that they care about each other. Every day I see people who are actually doing what we're asking them to do to slow the spread of COVID-19 and save lives. We are Canadians. When things get tough, we look after each other. That's just who we are. So thank you for all you are doing to keep one another healthy. To conclude, it is important to remember that 4 out of 5 people with COVID-19 have no symptoms or mild symptoms. Currently, there is no specific treatment for COVID-19. There is no vaccine. People who are mildly ill should isolate and care for themselves at home. Most will recover in 1 to 2 weeks simply by treating the symptoms. Notification of any future cases that turn positive will be shared through our website.